Welcome to our QWO webinar. Dr. Latowski will be right with you in just one moment, so hold on for us. Thank you. Everyone, just turn on. Okay, how are you? Can everyone hear me? Hi, Diana. Thank you so much for joining. Can everyone hear me? Oh, yep. Somebody indicated that. Diana, thank you. So today we're talking about QWO. Thank you so much for joining us. This is a revolutionary treatment, so we're going to tell you more about it. All right, let's start. Let's just jump right into the presentation. One second here. There we go. Perfect. Okay, here we go. So thank you all so much for attending today. And just for your attendance, because your time is super valuable, you are entered in a raffle worth over $1,000. So the winner of this raffle gets 1 QWO treatment and priority scheduling, 1 pair of underwear, the trendy hanky-panky underwear for your treatment, and something called elastin post-injection treatment. Basically, it's a blend of arnica and some other things that help to prevent bruising. So we will contact you, and thank you again. Let's see, how do I advance this? Okay, so we also have an event-only special. So today only, and for the first 10 patients, this is super, super great pricing, you guys. Purchase 3 sessions. So that's how many sessions I'm going to recommend that we do for a treatment, for an overall treatment session. So you are going to purchase 3 for the price of 2. You get a free session, basically. That's a huge savings and something we weren't really anticipating doing because this is such a new and innovative treatment. So for $2,300, you get 3 treatments of QWO. And then there's also a Mother's Day promo. Basically, have a spa day with your girlfriend, with your sister, with your daughter. And if you guys both come in and do the treatments, you each receive a complimentary booty toning session, so a cool tone session. I'm going to explain these technologies here in a minute. I just want you to be thinking about these while I do the presentation. So why are we talking about this? Cellulite is very common in women, and you can actually see it in men as well. So between 80 and 90% of women and 10% of men experience cellulite. So this is something that affects all of us. And one thing that's really frustrating is that it's not from a lack of diet, a proper diet, or a lack of exercise. So you can diet all you want, you can exercise all you want. There are certain people out there who will still have cellulite. And this is because of genetics. So genetics, hormones, and body anatomy all play a role in cellulite. So obviously we can't control genetics, can't really control hormones, and there's only so much body anatomy that we can control. So meaning weight gain and weight loss. What technically causes cellulite? So cellulite occurs when there's fibrous bands, so these connective tissue bands pull down, and it causes that dimpling effect that you see on the skin. So instead of looking completely smooth and flat, you have these bands pulling down. And then sometimes this worsens when the fat cells expand. So when the fat cells get bigger, they kind of push up on the bands and make the cellulite more obvious. That's why if someone gains weight, they feel like their cellulite gets worse. And I have several people in the office who just had a baby. So I'm looking at this picture of this little baby's bottom, thinking how cute that is. But for some reason, cellulite is only cute in little babies. So QWO is, as I mentioned, a revolutionary treatment. So as you know, I'm a huge believer in research and development, and I love offering cutting edge technology as long as it's safe and effective. So I am really excited about this product. I did a study for the company not that long ago. And then I also have served on their advisory board for the last year and a half. So I am very excited about this product, and I do feel that it is safe and efficacious. QWO is the first and only FDA-approved injectable for the treatment of cellulite in the buttocks of adult women. So that's what it's here. So I kind of touched on this again, but why should I trust QWO? So the company selected our office and selected me to be one of the first doctors to inject QWO. So first they started by rolling out to doctors, and now they're starting to roll out to some nurse practitioners and other injectors. But doctors were the first ones to inject QWO, and I was one of the first in the Valley. And I've also injected the most QWO in Arizona. So I am really excited about bringing this product to you. So what we like about it, it's non-surgical, it's minimally invasive. So we love that because that makes it safer. QWO is made up of enzymes called collagenases. These enzymes restructure the skin and break down those little bands pulling down on the skin. And so it's thought to reduces the appearance of cellulite dimpling in that way. But also, and this is just my personal take on it, just from my clinical experience, I think, and review of the data, I think that all the swelling induced by the QWO also stimulates some skin tightening too. So they go hand in hand. Patients tell me this treatment is not painful. By the way, I am signed up to get this treatment. I cannot wait to get this treatment. I just have to talk somebody in the office into doing it for me when I'm not working. But I am a huge believer in this, and I'm going to have this treatment done. But so far, the patients I have treated don't really have any issues with pain, FYI. So we love that. So again, QWO works in 3 ways. It targets and releases the fibrous bands, and the inflammation that results helps redistribute the fat cells. And then all that inflammation also stimulates the growth of new collagen, and I think results in skin tightening. So you're going to see a demo. We mark the dimples prior to treatment. And in my patient today, we marked one cheek/thigh, and then I will treat the other cheek/thigh off camera. I thought that would be useful for you to see it pre-marked already and then to see the other side unmarked. QWO is injected directly into the dimples using a small needle, but it's not just the dimples that are injected. We inject above the dimple, into the dimple, and below the dimple. And then, of course, it's not a gel, it's a liquid, so the liquid diffuses around. So even though we mark the dimples and inject the dimples, it's really like an all-over treatment. Injections take as little as 10 minutes. So it's actually, as a patient, very easy. There's some prep work that goes into the treatment for us, but as a patient, very, very simple. Okay, so there is definitely bruising with this treatment. So I tell patients, yes, you will have bruising. 100% you're going to expect bruising. Besides the bruising, there's no real downtime. For the exposed areas, I wouldn't want my patients to expose those areas to sunlight because that could result in some staining of the skin. That would be temporary but annoying over time. The bruising can take several weeks to fade. So that is something to realize going into this treatment. You're going to have bruising wherever we inject. and it does get better with each treatment. So if we do 3 treatments, each time is going to be less bruising, but the first time you're going to be very bruised. And in the studies, they did 3 treatments about a month apart. And so that's what we're recommending, about 3 treatments 1 month apart. But this is just a rough guide. I will help guide you. I will take a look. We'll talk about it. And you're not committed to 3 treatments. You can stop whenever you feel happy with the way that the treated area looks. So here's me injecting one of our first patients, not including the study. Here's some before and after pictures. These are courtesy of the company. So top is before and bottom is after. That's 2 months after first treatment. Again, courtesy of the company. Top is before, bottom is after, day 71 after the first treatment. And again, just you can see the smoother, how this transfers into smoother contouring when you're wearing tight clothing. Before and after, again, day 71. So it's about a month after the final injection. So each of these company pictures you've seen, the patients were treated 3 times, 1 month apart, and then the pictures were taken 1 month after the final treatment. And again, I think there's probably improvement that those patients will continue to see afterwards. Again, a little bit closer up, but look at that difference in skin tone and texture. I would be really happy with those results on myself. Okay, here's one of my patients. We only had time to give her 1 treatment, but you can see she's got reduction of the dimples. They're not as deep, and she doesn't have as many in the bottom photo. So top is before, bottom is after. We are going to do at least 2 more treatments, but she is absolutely thrilled with her results. Okay, again, before and after, I think this is having a little bit of difficulty transferring onto this PowerPoint because the top photo looks a little blurry to me. But you can almost, what this does demonstrate, you can almost notice a restructuring of the buttocks and how they look perkier and rounder just from treating those dimples and releasing those fibrous bands. It makes everything look smoother, and it gives that illusion of them being rounder. Again, before on the left, after on the right. This is after 1 treatment. Picture taken 30 days after treatment. We're about ready for the second treatment. And again, this is just a sample of what you can expect after 1 treatment. You will definitely see more improvement at the more treatments you do. So in the office, we have multiple treatments that we can use to shape the body. So not only can we improve the cellulite and the texture, we can use cool tone, which is something that contracts the muscle to make more muscle and to make the booty rounder and lifted. And I've personally seen great results with this from patients in the office. You can really, really contract the gluteal muscles and cause a reshaping of the buttocks. And when you combine that with other treatments, the results can be really dramatic. So Cool Tone, many of you know this already. It's a device that's intended to strengthen and tone the muscles. And we use it on the abs and the buttocks and the quads most frequently. You can use it in other places. So it can strengthen and tone and firm. And again, it's can do so in such a way that can actually reshape the buttocks. Doesn't hurt. It triggers really intense muscle contractions, usually more so than what we can do by going to the gym. But it works best when used combined with going to the gym and doing exercise. So we just place an applicator on the area, and you'll feel muscle contractions, but it doesn't hurt. And it takes about 30 minutes to do a treatment. And it's really, really awesome and fun to do. you get that lifting. This was after, I think, just a couple treatments, the lifting of the buttocks there. Okay, so I showed you the pictures, and I am going to demonstrate how we do this treatment. My model today is the lovely Paloma. She has volunteered to be our model. I want to say she also looks like a model. So please, please, please remember, you don't have to look like a model to do this treatment for yourself. This is something that should help you feel more comfortable, more confident in your skin. This is really something you do for yourself. And I just think it's an awesome treatment. Okay, so first 10 patients, and you can share this with your friends if you want to. Today only, get 3 for the price of 2. This is a savings of $1,300. So I think this is a fantastic deal. And if I was a patient, I would take advantage of this, knowing what I know about the treatment. Because like I said, I think it works and I think it's safe. And we just wanted to throw in a Mother's Day special. Heather and I, our marketer here, we just thought this was kind of fun. We would love for you to bring a friend.
Yes, do it.
Bring a friend, daughter, mom, and get the treatments together, have kind of like a mini spa day. And then you guys can also get your booty toned at the same time. So you can do this cool tone session as well. And I think that'd be really awesome. And it may even, thinking about the science of it, it may even enhance results because it increases blood flow to the area. That is not studied. That is not an FDA approved statement, but I think that's potentially something that could enhance your results. So think about it, ladies, gents. You can bring your hubby in, you can bring your wife in, whatever you want. Okay, here's our model's buttocks. I wanted to show you this because sometimes, as you know, the lighting can either accentuate or mask the dimples in the butt and thighs. And so she's concerned with dimpling on the buttocks and the thighs. So we're going to do a little bit of treatment of both. Again, this is only FDA approved for buttocks, but as a physician, I can use this off label. So I'm going to today. And you will see me treat one side. So give us one moment for us to set up here. Then we're going to show you her buttocks with her standing, and then she will lay down for me to do the treatment. So one moment here. Thank you so much for your attention and for joining. Can you guys hear me now? All right. Sorry about that, guys. Thank you so much for commenting. Okay, so we just did that portion without the sound. Let me just recap for you. Can you go up a little bit? Okay, cool. So I was just saying that you do not have to look like gorgeous Paloma here to do this treatment. But what she said is that she wants to notice a smoother texture, and she also wants less dimpling. So she's a perfect candidate for this. We're not only going to get rid of the dimpling, we're going to smooth out the buttocks so she can feel more confident about herself. And let's see, what else did we say? That was about it. I was just saying that she's already been cleansed. We cleansed with rubbing alcohol, and then HibaCleanse, which is a surgical soap, and we are ready to do the treatment. Okay, here we go. We'll start with at the top here. Let's see. Perfect. All right, ready, Paloma?
Yep.
Okay, here we go. First one, pinch. You okay?
Yeah.
Perfect. Pinch. Perfect. Okay. How was that?
Okay.
That's it.
That was nothing.
So I don't know if you guys could hear Paloma. She's got a very quiet and gentle voice, but she literally said, "That's it." So she did great. And that's really all there is to it. And then we just go and inject each of the dimples. Like I said in the presentation, this is going to diffuse out. So it's not like we're just treating these areas. It's actually going to diffuse and treat the entire area near the injection. Did you numb the injection area? No, we did not numb it at all. This is something that dissolves the fibrous bands. And so it's not like a filler where you can go in and dissolve it. It's really your body doing most of the work. So no, this is not reversible, but there's really no need to make it reversible because it just produces inflammation. Okay. Mark that one. Let me see if I can see another question. Can you use it on the front of the thighs? Yes, you can, and I have. And I really like it on the thighs. Now, on the thighs, to be honest, a lot of times I do recommend combining it with something like Sculptra or Radiesse, which are products that are going to thicken the skin and produce some lift on their own. So a lot of times on the thighs, we see that dimply appearance because we've lost collagen and the skin starts to sag. Totally normal. But we want to get rid of some of the sagginess by not only dissolving the dimples, but also adding some support back into the skin. And so what we do is thicken the skin and make more collagen with the Sculptra or the Radiesse, which also lasts a very long time. And so it can be a combined approach, but we can really do a lot for the front of the thighs. Will it break up scar tissue from abdominal surgery, scar tissue that has been dimpled, etc.? Well, I don't think they tested that yet, but I would love to try it. Let's see, let me think about that a second. The scar tissue from abdominal surgeries actually probably is a different type of collagen than what this treats. So it may not do what we want it to because the type of collagen is actually different in scars than fibrous bands. Can you use a cannula to break up the fibers? A little like what they do in surgery. Yes, you can use a cannula for the fibers. It's a lot rougher, but it's very similar. And there's actually a device called the Selfina that you can use to do that manually. It's just very rough. And this basically does the same thing. And I think actually does a little bit more. I think this is going to be more useful than doing it manually, but you can do it manually and that's acceptable. How long does it last? This is a permanent change. So your body will not go back to having cellulite, the cellulite that we've treated. Now, if over time, and by the way, we are done. I'm just going to apply pressure here. If over time you were meant to get worsening cellulite, then you might want another treatment in the future. But it's not like this product wears off like Botox or filler. This is a change in your body structure, and it's just awesome. I am considering lipo on my hip fat. Can I use QWO after I heal from that? Absolutely. It's great because liposuction does not treat cellulite. It removes fat, but the fat from cellulite is too superficial for liposuction to effectively get. So liposuction and QWO would actually make a great combination. Okay. Okay, guys. Well, that is it. We're all done. Paloma, if you could talk a little bit louder, how was that?
It was not bad at all. I barely felt the needle. Super easy.
Awesome. Okay. And would you recommend it?
Absolutely.
All right. Okay, guys. Thank you so much. Thank you so much for tuning in. We'll see you next time.